In February, as I was heading out onto the road, I had medical tests done, and what brought it all about is that I started having a period. I've been in menopause. This is weird stuff to share. I've been in menopause for several years, and all of a sudden I started having a period full on. My breasts hurt so bad I couldn't tell you. You couldn't even come near me. And so I went to the doctor, and they took an ultrasound, and they came back and said I had a large mass on my ovary. And my doctor said, I want to do an MRI. I want to get a closer look at everything before we operate. And she did, and that test came back and said, it's not a large mass, it's 2 cysts. I was just like, oh my God, okay, what a relief, what a relief. But then I was like, well, 2 cysts, we're going to do one more ultrasound and take a look at it and make sure that concurs now with the MRI, and it did. And so I was really happy about that, but I forgot to ask what does that mean now with 2
Well, you're not
cysts?
done. I'm sure your doctor's going to follow you. But you know, one of the most important things, you mentioned this started with bleeding.
Yes.
And postmenopausal bleeding, we have to separate actually because you've got 2 issues. You know, first what's going on in the uterus in terms of bleeding, and then what's going on the ovaries in terms of cysts. They are unrelated. Okay, so first to start, you don't look like you're postmenopausal, my love.
God bless you, sister.
You look like a kid, but you know, in women's health, what's very important is after menopause, any vaginal bleeding whatsoever is cancer until proven otherwise. So you did the right thing by calling your doctor. Now, luckily, most cases are not cancer, but you can't chalk it off and say, well, it's a little this, it's a little that. A lot of my patients will say, well, it's just a little blood.
And it stopped.
Right, and it stopped. And I have a little model.
She's got an ovary right here.
She does.
Here's a little uterus, isn't it cute? So, you know, this is the gray thing over here is what a normal ovary would look like. And after menopause, they actually are so small, they're about ½ an inch. So it's not uncommon when we do an ultrasound that we actually can't find the ovaries in a postmenopausal woman. On this side, what you can see, this gray represents a cyst or a mass. Now, women tend to freak out when they hear you have a cyst on their ovaries. What I tell my patients, I'm sure, Rachel, you say the same thing, ovaries make cysts for a living. That's their job. That's what the ovulation process is. However, when you go through menopause, your ovaries should be kind of asleep. Yeah. They should be in hibernation. So when you find a large cyst, or in your case, you had 2 large cysts, right, on your ovaries, then you do start to worry, is this benign or is this malignant? Now, you had a blood test done, right?
I just had the CA-125, which I heard is very controversial because there's a lot of false negatives, a lot of false positives. So mine came back negative recently. So I was cleared on that. And then they also just recently did a biopsy on my uterus because they felt that that lining was very thick and had some questions about that. And I can say for the first time that that came back negative. Okay, doctor, so my other really important question is that given the results of my test, should I consider having a hysterectomy if I could have one and just be done with all this stuff and never have to worry about it again?
I mean, we hear that question all the time. You know, having a hysterectomy is not like getting your nails done. It's major surgery, and you have to take into account your family history, your age, the size of your uterus, the size of these cysts on your ovaries. There are a lot of factors that go into that decision, and also what path of the hysterectomy you can have. Can it be done laparoscopically, vaginally, abdominally? That's a big, long discussion that you should have with your gynecologist.
And it depends on how aggressive you want to be with this. You know, are you more the type that wants to just do some watchful waiting, or do you want to be aggressive enough to, you know, go through something like this? So I think you have to keep that in mind.
I'm at the point after all these tests, I want to be aggressive.
Okay.
You know, it's hard hearing different kind of news constantly and always worrying, you know, that this is going to be your future is what you think this is going to be.
And Mary, we are so glad that your test came back.
Yeah!
Thank you.